blockage of COVID up to 6 to 9 months, and there's not many private audiologists like myself, at least locally, who perform earwax removal in children. Obviously with children it's a bit more complex, well, a lot more complex, because they're typically less cooperative and unsteady, and some are obviously understandably very anxious and nervous. And so this first patient, after the procedure, he called it life-changing himself, hence the name of the video. And it was his ear was so blocked, and it's a combination of dead skin. You can see the keratin that's enveloped this plug of wax, but also wax. This patient was 7 years of age. The left was completely blocked. They've been using drops for weeks and weeks and weeks, and actually they got recommended. They went to a high street. I don't like mentioning specific high street names, but and the audiologist there actually recommended the patient. So me, as I said, they don't treat young patients. I think they've got a strict guideline, 18 and above. So the patient was recommended, or the patient's father, should I say, was advised to contact myself. So they've been using drops for, I think, 6 months. This has been going on for ages now. The poor child's been struggling at school, and you can see the eardrum there. Now it's very wet and gooey, just because, as I said, they've been using drops for 6 months. We leave that, guys. We're not going to try and get that out. Perfectly healthy eardrum. We performed a test called tympanometry to assess the middle ear compliance, the mobility of the eardrum. That was perfectly fine. Now on to the right ear. Now this plug of wax and skin, it extends all the way from the entrance of the ear all the way to the eardrum. Now you might have seen my glove there. So what I'm doing, because for children the ear is a lot more narrower, bendy. So I'm just stretching this patient's ear open with my left hand. Just open up the ear canal and straighten the ear canal. I then insert the endoscope into the ear, and I use the endoscope like a doorstop. I'm pushing the cartilage to the left to keep the ear canal straight and open, and then allows me to insert the ulnar suction probe. You see a huge lump there, and there's the patient's eardrum. We've got a light reflex, and it was astonishing the difference it made to his hearing. It really was. He'd been struggling at school, struggling to sleep at night because of the pain. Patients were really, really happy, overwhelmed. And there's some close-up shots of the wax plugs. This patient, a bit younger, I think she was 4 years of age, and she was a bit more unsteady, obviously a lot younger. Now, her ear canals are a bit more narrow and twisting. She's got dead keratin here, so this is just dead skin. It's just a sheet of dead skin, that's including the ear canal. I have a feeling that the patient's parents have been using cotton buds on the right side. The ear canal's grazed a bit. And whenever you ask patients or the parents, they kind of always say no. But you kind of know when people have. You just tell by the condition of the ear canal. So I'm just using a fine end gauge here. You can see it's quite reflective. That's normal with skin. It wasn't affecting me, but we have got the ability on our eye clear scope to reduce the exposure, the brightness, and I did use it on the right ear, so if you keep watching. Now you can see my glove there again, so what I'm doing, I'm just pulling, this is the left ear, pulling the ear back and up. So back to the right, up towards the ceiling to stretch the ear canal open, and then inserting the endoscope into the ear canal. I'm using it as a doorstop. I'm pushing the cartilage to the right to keep it ajar, which then allows me space to insert my ulnar suction probe. Now we can see the eardrum. We're not going to be too clever. No, this piece of skin is just more lateral. If it peels off, great. If not, we're going to leave it. We're not going to try to do too cute and clever. It's a young child. We don't want to cause any injury. We don't cause injury to anyone. There's the eardrum. There's an attic retraction, so they have got a bit of eustachian tube dysfunction. We did do a tympanometry test again. With children, typically after I remove the wax, I also test to make sure they don't have any catarrh behind the eardrums. It's quite common when you've got a blocked eustachian tube, they can develop glue ear. So we did do tympanometry on both sides. The left side, although the eardrum was retracted, the mobility was within normal range. The middle ear pressure was obviously was also more or less in normal range. So this is the same patient's right ear, and again, there's a lot of keratin. You probably saw at the beginning, I just reduced the exposure because we're getting a lot of reflection. When you got a narrow ear, hard ear wax, a lot of skin, a lot of hair, typically the light reflects off the object back into the endoscope, and it can be slightly reflective, so we just reduce the exposure a bit. Now just see how narrow this ear canal is. It's just got trapped, this plug at the entrance. This is the entrance of the ear canal, and the wax plug is just there. It's trapped. It's larger than the entrance. I'm just rigging it. So when I treat patients, I kind of always make it like a game and make it fun. I'm going to play a listening game here, and the way I condition them for the procedure. When I examined the ear prior to perform the procedure, I said, look, we're going to look in your ear, we're going to take a video, we're going to watch it together, all of us, we'll get the popcorn out, and but you have to promise you don't laugh. And they said, why are we going to laugh? Because, well, it does tickle when I look in your ear. And it just really puts them at ease. So I hope you enjoyed that video, guys. Take care.